Hello anatomists, this is your video to prep you for the fetal pig digestive and respiratory systems. First we'll tackle the digestive system. So when you look at the face, you'll be able to identify several of the salivary glands that are present in the fetal pig. So if you need to dissect a little bit more, you can follow up from the neck, which should already be open from the cardiovascular dissection, and just remove some of the skin in the face. So you just move up from the neck area and remove the skin and move up to just under the eye will be plenty. This will help you to identify the masseter muscle, which is the cheek muscle right here. It's a nice big round muscle. And as you get to the masseter muscle, you should be able to find the salivary glands as you head that way. The parotid salivary gland will be the largest. It often is kind of crescent shaped right here, so you can see it's very large. If you don't see it at first, try digging a little bit more underneath. You may have a muscle that's in the way, but the parotid salivary gland is quite large. It encompasses all this area that you see here. And then nestled on the inside of this crescent is a smaller, although still substantial, submandibular salivary gland. This one is usually quite round. A lot of people accidentally mistake it for the parotid gland because it's pretty large, but if it looks pretty big and round, but you can see some glandular tissue behind it, then this one behind is the parotid gland, and this one is the submandibular salivary gland. The sublingual salivary gland is quite a bit smaller. If you follow it up just a little ways, it'll be this small little area right here, the sublingual salivary gland. All of these glands have kind of a chewed up bubblegum texture to them. If the tissue appears striated or striped, then you have found muscle instead of gland. As we work into the mouth, you will need to open up the jaw as much as possible so that you can have good visibility. You'll want to open the jaw enough so that you can see the epiglottis. And so you'll probably need scissors to cut open the sides of the mouth, and then use your thumbs, one on the hard palate here and one on the tongue, to pry open the jaw as much as possible so that you can have good visibility. If you cannot see the nasopharynx or the epiglottis, then it is not open enough. And be careful, the fetal pigs have some teeth. They're small, but they are kind of pointy. So just use care when you're opening up the jaw. Here you see the external Nerys teeth. If you feel bone underneath, especially this ridged area, this is going to be the hard palate here. Over here, where there's no ridges and there's also no bone directly under that tissue, then that is the soft palate. And the opening behind the soft palate, you'd have the nasopharynx located back here. This little flap is the epiglottis, and if you travel or put a probe in through that opening, that would be the glottis. And then here is your tongue. As we look into the thoracic and abdominal cavities, your pig should look something like this. You can see the liver takes up a pretty large chunk of the abdominal cavity. Here's your diaphragm right there. Here is your small intestine, and then you can see a little bit of your spiral colon down here. If we take a little bit of a closer look and we lift up some of the lobes of the liver here, you can see this slightly greenish sac, which is the gallbladder. You can also see this stomach right here. And directly underneath the stomach, you can see the pancreas. You can see just a little bit of that pancreas right there. Here is your jejunum and the ileum as it leads into the large intestine. The duodenum is right here as it heads into the stomach. Here's your spleen off to the side, and the cecum is the entrance into the large intestine. The large intestine is a little bit different in the fetal pig than in the human. The main part of their intestine is called a spiral colon. So in contrast to humans, their large intestine is bound up in a spiral like this. But you can still see the cecum as you head into that spiral colon, and you can see the rectum as we look at a different picture and move these to the side. You'll still have the rectum. Here is a better view of the pancreas. So here's the liver up here. This is the spleen, this long organ right here. Right here is the stomach. And if you lift that stomach up, you have a pretty good view of the pancreas. The pancreas always looks like chewed up bubble gum. So if you see this texture, you know that you've found the pancreas. Here is the umbilical vein as it heads up underneath the liver. If you're hunting for the hepatic portal vein, here is a picture to help you. So if you lift up the liver, lift up the stomach, here's your hepatic portal vein right here, and you can see the mesenteric vein draining into that. So you have all of the venous blood draining from the spleen, the stomach, the intestines, all drains into the hepatic portal vein to deliver that blood to the liver. As you look at the intestine, if you spread it out a little bit, in the small intestine you can see this clearish tissue that's binding the tubing of the small intestine together, and this is mesentery. Here is another look at that spiral colon right here. Right here you can see pancreas, up above this, the stomach right here, and here we have a better view of the rectum as it leads down into the pelvic cavity. Here is the cecum over here, and you can see the ileum leading into the cecum right there. You're also responsible for looking at an adult pig stomach and recognizing the different parts of the pig stomach. This is going to be very similar to the human. So here is your esophagus as it connects into the stomach right here. So your lower esophageal or cardiac sphincter would be right here. This area is the cardiac region of the stomach surrounding right where this esophagus enters. Here is the fundus. Most of this area is the body, and then over here is going to be your pyloric region and pyloric sphincter in the middle. Greater curvature comes around this larger area, and lesser curvature is going to be this smaller curve in here. If you open up the stomach, you can see all of the rugae, or these folds, very clearly. These are the ones that flatten out as the stomach fills with food. And over here is the pyloric sphincter. You can see the thickness of this musculature as you get to the sphincter. Moving on to the respiratory system. The upper respiratory system will be pretty similar. You have a large thyroid cartilage in the larynx. You can see the cricoid cartilage as well. Here's your trachea. Those tracheal rings are visible and you can palpate them. Once you get to the lungs, things are a little bit different than the human. On the right side, there are 4 lobes to the right lung. So over here, we have right lung all the way over here. So we have the cranial lobe, the medial lobe, the caudal lobe, and the accessory lobe. And these are all part of the right lung. When we look at the left lung, it has 2 main lobes. So the caudal lobe is down here, but you'll notice this lobe, it almost looks like it's divided into 2 lobes, but it's not really. There's not a division all the way through. So this whole thing is called the apical lobe. So you have the apical lobe and the caudal lobe on the left side, and then the apical lobe is divided into segments. You have the cranial segment of the apical lobe and the medial segment of the apical lobe. So if you're writing answers down on a quiz or exam, your answers, especially on the left side, may be quite long. For a complete answer to get full credit, for example, if the pen is in this part of the lung, you would need to put cranial segment of the apical lobe of the left lung. So just make sure that you put your complete answer down for those. We also have adult sheep larynx available for you to view, and this will be similar to the human and the fetal pig parts that you're able to see. Here's your large thyroid cartilage. Here is your cricoid cartilage. This is going to be the anterior side right here, and then here's the posterior side over here. Here's the trachea, and you can see the tracheal rings past the cricoid cartilage. And then here you can see just a little bit of the esophagus running along the posterior side of the trachea. You may not see the esophagus on your model, and that is perfectly fine. Make sure, as always, when you're looking at fetal pigs or any specimen, the larynx or the stomach, look at as many different models as you can so that individual variation won't throw you off if you get a slightly different one on a quiz or exam. Looking at the inside of the larynx, from above, here is the thyroid cartilage going all the way around here. This opening on the inside is called the glottis. Here's the epiglottis. Remember that closes to make sure that air goes down your larynx and food goes down your esophagus. And here you can see just a little bit of the vocal cords. A lot of times these membranes are damaged or they're really difficult to see in here, but try to find them the best you can. So that concludes a review over the fetal pig digestive and respiratory systems. Please don't be afraid to ask any of your teaching assistants or instructors if you have any questions.